So on behalf of the HIMSS New York State Chapter Election Committee, we welcome our candidates. Our candidates are on the ballot for secretary board member today, and we will be hosting a quote unquote debate. So we get to know more about each of you. But before we begin, I'd like to go over just a couple of rules of engagement. The members that are on right now, Yasmin and Tom, and I'll fill in between, will be asking the questions. We're going to ask you to give 2 minutes for your response. After that, as I just showed before, I'll raise my hand. If you see the hand come up on the screen, that means your 2 minutes is up. We'd like you to stop so we can continue moving. I'll be keeping time as well. I'll try to be as little flexible with the 2 minutes as possible. And then this will be each question, each of you will have an opportunity to answer each of the questions that come up. So before we begin, what I'd like to do is a quick 2-minute introduction from each of you. And let's start with the way that we came on the phone. So Julie, why don't you start us off?
Hi, I'm Julie Lemengus. I'm the Chief Nursing Informatics Officer at Stony Brook Medicine on Long Island.
Neil?
Hi, everybody. My name is Neil DeLuna. I am a IT lead at New York City Health and Hospitals.
And Sylvia?
Good afternoon, everybody. I'm Sylvia Bronson, and I'm working with the DOH as one of the Excelsior Fellow, and I'm working with the data analytics and data services for the DOH in the data governance.
Excellent. So let's get right into the questions. And first one up is Yasmin. And start with Julie, followed by Neil, and then Sylvia. Yasmin, you're on mute. Yasmin, there you go.
Okay, I should be on now. Okay, I'm happy to meet all of you. And let me start with Sylvia.
Sure.
Go ahead and ask the question, Yasmin. You're on mute again. Yasmin, you're on mute.
I'm so sorry. Seem to be having some issues here. Sorry, guys. Okay, Sylvia. As a member of New York State HIMSS chapter, can you tell us some things that you think we are doing right at the moment? And what changes you think will benefit our organization?
The HIMSS charter are doing great things. For example, the activities and events that have HIMSS chapter for all the professionals that they're in New York. So, for example, when the members can go and attend these kind of meetings, it's very inspiring for them and for us. This is my case. So I think there is a great commitment of HIMSS to do this kind of events, and they are free, so the members can go and network in there. And the other thing that I think HIMSS can improve will be sometimes I think if the membership will be a little less expensive, maybe it will be great to have more members, but it's my thinking. And I think that's the two things that I will say for now.
Thank you so much. Okay, Neil, we'll move to you. Same question. As a member of New York State HIMSS chapter, what do you think we're doing right? And what changes do you think will benefit the organization?
Thank you.
Why?
So I think so far, the innovation with HIMSS has been very great. The inclusivity has also been a plus in terms of being able to adapt to the current times that we're in. For example, before long ago with the memberships, it's in person, but now that we have a lot of remote work happening, we do have like trials or options for remote membership. And I think that's what's probably most important, because as we know, many times, for example, like how I am at the moment, we may not be in New York, we may not be to attend or able to attend a lot of the events that Sylvia had alluded to. And I think that would be a negative part as being a member, because every member has something to contribute. We're in this as members to be able to help contribute, to help innovate, and help to bring about improvement to the healthcare IT. And what I think HIMSS could potentially improve upon is to cast an even wider net. So not only to professionals currently that are interested, but I think to be able to reach out to potential healthcare students, medical students, students within IT who don't necessarily have a clinical background but are interested in the field of healthcare. And what I think that would accomplish, coming from experience, is being able to help students who don't necessarily know where they want to go in their career, but give them the opportunity to participate in something like this and to be influenced, because that's essentially what I had felt when joining HIMSS. Thank you.
Thank you, Neil. Tom. Sylvia, I'm sorry.
Julie.
Julie. Oh my gosh, what's happening to me today? Julie, same question. Would you like me to repeat it?
No, I have it. Thanks, Jasmine.
Okay,
I appreciate
beautiful.
the offer. So what I think is doing well, I agree. I believe the education events and the opportunities available is brings our members the ability to increase their knowledge and network. And I do feel that the ability for the local chapter to transition to the hybrid option was really an excellent opportunity. As mentioned before by the other candidates, always accessing and coming into the city can be a little bit difficult. So I think it's really good that the organization has expanded to the hybrid opportunities. And I think the information that comes out, there's always information coming out almost weekly about the latest topics, industry events, and what's occurring. Opportunities. I know that we've had some events, I believe in Buffalo and a couple areas of the states, looking out to see where the majority of our members are outside of the city. How can we reach them and provide them the same in-person type opportunities? And I'm not sure if we've also looked to partner with the other states that are in the tri-state area to see what we can do for expanding opportunities and engaging with them.
Thank you so much.
Great, thank you. I'll jump in with the next question. It's great to meet you all. I'm Tom Hallisey with the Healthcare Association. And we'll start with Julie this time. We'll go Julie, Neil, Sylvia. So I just want to ask the very general question, what do you hope to accomplish as a board member, and how would you define success?
Oh, great question. So as a board member, what I'm looking for is to be able to give back to our local chapter and also understand how it operates, how decisions are made, and the impact it has to our members. So that's my interest. I've been a member of HIMSS since 2004, and I personally have benefited from the association, from the different events. I've lived in multiple states, but I will say I'm very excited about the New York chapter. I've been here 5 years, and I knew about all the events that occurred. And of course, right after moving here, we have a little thing of COVID-19 that decreased it, but I'm interested in, us continuing that journey of the education events. Success, I think success is how we increase and maintain our membership. So how do we keep the members that are currently involved? How do we increase it and that engagement? So it's great when people come to the events, and we like that, but it's also nice when you see more members engaged in the different task forces.
Great, thank you. Neil.
You're on mute, Neil.
Sorry about that. Thanks for the reminder. What I feel regarding that question is that I think we ought to kind of get back to our roots here. So coming from New York City Health and Hospitals, New York State has been a soft spot in my heart growing up here, and being able, like Julie said, to give back to the community. Many of the patients that I see were family members or neighbors, so it does hit home when um, being able to participate in the New York State chapter and being able to give back to that. And like I mentioned earlier, I really do want to be able to help reach out to the crowd that's not necessarily in their career already or professional pathway. And I think being able to successfully access that and have them more engaged in many of the events that we have, and give them a chance to give their feedback would be very beneficial. And I think from the experience that I've had being new to this profession, I think I would be able to provide that new feedback and new optimism. Thanks.
Thank you, Neil. Sylvia.
Well, I will say that HIMSS does a great job getting all the technology and kind of developments and advances get into the website and can promote that. And also the other part that I can say is the inclusivity of the different kind of students, professionals, uh, university, academy is great. And for success for HIMSS, I think continue increasing the engagement with people, not only with members, but also with the community. One part that inspire people is to know that HIMSS has been not only working with the technology and with private companies, but also with the government, with with um, with policy. You know, they have the website and the page for policy, how to as a regular person or go ahead and go for policy for the improve maternal health. I think these things going to bring HIMSS to the success. Like trying to be not only HIMSS as the no a non-profit organization, but to try to get the attention of everybody globally. This is another thing that I really like of him, that we want to go globally. I was so excited when I saw events that they were having in different parts of the world. And for me, as a person that I come from Ecuador and speak Spanish, I was so excited. And also, I was part of this Latinx community that we get together professionals for health IT. We were talking about not only the future in the United States of America, but how HIMSS can help integrate these advances globally. Thank you.
Thank you.
Okay, folks. We'll start with Neil this time. Are you currently a member of the New York State HIMSS chapter committee? If you are, please tell us your experience with the committee. And if you're not a member of the committee, which committee would you be interested in and why?
I'm currently not a member of the committee, but what interests me most is anything regarding change policy. So I feel as if that HIMSS would be a great platform to be able to advocate for many of the policies that we potentially have these days. And one specific policy that I was hoping to further was something that I actually did for my master's degree in nursing, which is having some type of governmental policy that requires organizations and their neighboring organizations to participate in some type of external data sharing, which I think is probably one of the most important things that we can come upon this day, now that we have examples with COVID, with patients accessing different healthcare systems and finding care wherever they can. Many of the resources that these patients have are very far and few between if they're not able to access them in a timely manner. So any committee that would be able to help push that along, or even help just develop it somehow, and may not necessarily be something that I would be able to see the end of. But if it's possible to spark that somewhere, wherever I'm placed or wherever is has that interest, I think that would be a great accomplishment on my end. Thank you.
Thank you. Julie, wanted you take that same question on?
Sure. So my involvement has been with the Nursing Informatics Committee, with the New York chapter, the national chapter, and with various chapters where I lived. I've also been on a couple other committees as well. The executive committee also looked at launching the HIE committee years ago. My interest with nursing informatics gives me the ability to focus on how does the solutions impact patient care, bring my nursing experience to that committee, understand what's the impact also to the ancillary as well. But we look at the IT solutions, the clinical impact, and try to understand the overall impact to the patient, and then honestly the industry. When we're looking to see what is the industry delivering, are they meeting what the needs of the patient? It's an opportunity for us also to give feedback to vendors, to say this is what we're looking for as the solutions we need, and be able to give feedback for them as they're developing or they're implementing a solution, that they can take that back to their team and say this is what the nurses are looking for. And it helps when you have an understanding of the technology and of the nursing side. I also benefit, so I give to the committee, but I benefit from the committee. I learned so much around healthcare technology and from other nurses that I interact with regarding what they're doing, what are the outcomes of the solutions they've implemented, the impact to the patient, and how it might benefit our organization and our patient population.
Thank you. Sylvia, if you can answer that same question, please.
Yes, thank you, Anthony. Currently, I'm not a member of any committee, but actually, I think this is the path that brought me here tonight. I would like to be part of the health policy and advocacy. Was one of my interests, because as I was working in a hospital, and now when I'm working in the UH, we have the solutions, we have the technology, we have the workforce, but we need a lot of policy to help patients to get access to care. And the other part will be also was the other committee for emerging leaders that I wanted to be part, but I think I needed to wait until the fall. So there will be other part, because I think, as I say before, having all the population, the community get involved with the HIMSS will be great, and also how to get the new leaders that can understand better the population health, the social determinants of health, that can, make HIMSS very strong institution and organization for the country and for the state and for everybody.
Thank you.
So let me pick up from here, Tony.
Please.
Let me give my next question to Julie first. In your mind, Julie, what is the difference between a board member and a committee chair in terms of authority, influence, or obligations?
That's a great question. So for me personally, as a board member, you are serving the chapter members and the community. So when you're making those decisions, you have to be cognizant of the work the committees are doing. You have to be cognizant of what your membership is looking for in terms of the local chapter to provide, understand where we need to go in the future, and be thoughtful about the decisions being made, that it's taking into the current needs and the future needs of our membership. And there's a duty to that comes with it, to remind ourselves that we're serving and we're working for our membership.
Thank you. Thank you so much. Let me turn this over to Sylvia. Same question. In your mind, what's the difference between the board member and the committee chair?
Well, the committee chair, for in my mind, brings all the ideas that the organization has after studying the data and having these proposal in initiatives. The board member for me is the group of people that they have knowledge of different aspects of the topics that the HIMSS manage. So, and they have the responsibility to not only give a vote, but also to analyze how the decisions that they do impact the whole entire organization.
Thank you.
Thank you.
Thank you. Neil, same question. What's the difference between the board member and the committee chair?
Great question. So I find the relationship very interesting in that, holistically speaking, from the board member's situation, it needs to be addressed within an interdisciplinary approach. Things need to be addressed from a standpoint of facts and research that's provided to them, and being able to be cognizant, as Julie mentioned, that this vote is very important, not only for yourself, but also as a member of HIMSS and being able to represent them. So with that power, the board member really needs to be aware of the decisions that are being made and the repercussions and consequences of their vote. And frankly, from an interdisciplinary approach, it works well when having all the information that you have from the different committees and being able to make an educated decision. Thanks.
Thank you.
Great, thank you. I'll jump in with another question, an HR interview kind of question for you all. We always hear about the great work everybody's done, but do you have an example of where you've really made a mistake, where you made a decision that turned out poorly, or you started a project you had to cancel? And how did you handle that, and what did you learn? And we'll start this time. Let's see, we just started with Julie. Sylvia, we'll start with you on this one.
Okay, thank you, Tom. I'm thinking about that, and I will say project. Okay, so let me think. Oh yeah, recently we are working in expand our division, and we were working in the document for the chapters for the division, and I was so excited to start and do the documentation and put together the ideas. But suddenly we knew it was too soon, because the directors and they decided to go and create new chapters for this division. So okay, so I have to say, okay, all the work that I did is not a waste of time. It's going to be there. With that, I learned a lot, and we will have this information for when we are going to create the two next chapters in this case. And yeah, so I will say that at the beginning I was thinking, oh, all this time that I put in there, and now, but after I said, okay, no, I want to have this and use that for the next iteration, for the new more verticals that we are going to add to this division and administrative part. Mhm.
Thank you. Thanks for sharing. Neil, same question.
So prior to me being in the IT lead that I am now, I was a consultant. So I did have the privilege of working with many healthcare systems across the United States and seeing the different ways that these organizations work. And one of the memories that I had, which was a big turning point in my career, was a project in the East Coast where we were looking to improve the financial billing of a specific department. And the way that it worked was that we were canvassing a lot of the information from a lot of the end users, a lot of stakeholders, chiefs, departments, you name it. And internally, from an IT analyst standpoint, we thought we understood what the needs were, and we were able to make a decision on how to get them to where they needed to be, which was really increase their revenue. But as I mentioned earlier, with the interdisciplinary approach, it was really important for us to get back to the end users, because we did find issues and weaknesses in the build that we had implemented And after having spoken to those end users, we did cut our timeline a little bit tight. So it ended up being, working very long hours and putting in extra work that we didn't anticipate. And from a career standpoint, I think that was my biggest turning point because I understood a lot. Excuse me, I understood a lot of the change policies and the importance of being able to communicate openly and making sure that all the T's are crossed and the I's are dotted.
Great. Thanks. Thank you. Julie.
So one of the biggest projects that we had that failed, and then we had to come back and say, okay, what are we going to do differently, was our first run at implementing CPOE. And we thought the easiest thing was to implement the order sets that we already had with a few changes, and then we would take them across the system. And at the time we had 3 hospitals. And we thought our biggest barrier was quite honestly, was the human change of using the computer. And we thought that would be the biggest process versus someone, writing their orders on paper, dropping it in the bin, and somebody else taking care of it. And our physicians across the system flat out refused. They said they weren't going to use it. They refused to use it. And so then we took a step back and we started meeting with the influential providers to understand what was the barriers. And what it turned out, the biggest barriers had to relate to the technical functionality of the system. We had hanging, we had freezing, the time to log in when, you were supposed to like tap and go, but they would tap in with their badge and it would take a minute, but none of us had been monitoring those type of key elements. In addition, they wanted to have their input on the order sets, where we had order sets at 3 different systems sites. So what we did was we brought them together. We made a list of the issues that were the barriers. We engaged the right teams. We published the work that was being performed. We had confirmation from them as well that they were seeing a difference in the functionality of the system. We involved every provider that was from different specialties in the design of standardized order sets. We engaged them with how the training would occur, the timeline for training, implementation support, the numbers of people, how long they would be out there, and involving them with those details and engaging them through that process. Although we delayed for a year and a half, we had a 95% implementation of CPOE within 3 weeks of starting the project.
Thank you. Thanks for sharing that.
Okay, up to me now. How do you convince others of a concept or a design? And what if they still disagree with you after your best efforts? And let's start with Neil, followed by Julie, and then Sylvia.
Great question. Early in my career, I was the liaison for an ambulatory nursing work group for New York City Health and Hospitals. And I remember one decision that was hotly debated was allowing certain clinical staff to work to their full potential, only because many had disagreed that we may be overstepping in terms of responsibilities. And while I did feel that from a technical standpoint and having experience in that and being also a previous end user, I did see the benefits in this. I did see the potential positive patient outcomes. I did see the positive outcomes within the clinical staff themselves as they work amongst themselves. And many, I would say majority, disagreed with it. So what I ended up doing was I took as much data as I could from medical journals, articles, as well as consulting with a lot of the experts in that field for IT and that functionality. And I essentially created a bigger presentation as a follow-up to that in order to be able to influence a few more folks that this is the right way to move. And thankfully, I have been able to say now that I achieved that feat, and many of the nurses in New York City Health and Hospitals now are actually working to their full license potential.
Thank you, Neil. Julie?
So the first piece is I want to make sure that I understand the problem that we're trying to solve, the goals of whatever the solution is that I'm trying to influence. It could be a solution, it could be a process. for our clinicians to utilize. And understanding that, making sure that we're meeting the goals of what we need to. The second part is if they're pushing back, asking why, trying to understand why they're pushing back. Sometimes you also have to check your own ego at the door to say, does it really have to be the way that I'm presenting it? Or do I need to step back and make the changes that they're requesting and modify what we're presenting? It's not always that we're correct. If it is something that we do have to implement, getting the research, presenting the rationale, what are the pros and cons, what is the purpose of the solution? And if it's something like that that we have to implement, then looking to see who are the other influential leaders. If we're not able to make that change and get them on board, it's finding out who's the other influential leaders that can assist us. It's not always the title, it's the person who can influence.
Thank you.
Okay, let me
Sylvia.
Julia.
Yes, for me, I will say the first step for me is to analyze the problem that I want to resolve, and also ask the stakeholders or sponsors what is their ideas, what is the reason they want to improve or change this process or this quality initiative. So once I understand, first of all, what they want me to do, or what we are going to do together, I can present my ideas, my plan. And if this doesn't work, it does, they don't agree, or they say, oh, this needs changing here, changing there, we have to check budget and resources. For me, the thing that work is to engage the stakeholders, sponsorship, and all members involved, not only the C-suite or the directors, but also the ones that are going to do the work. So with the ideas, with the workflows, show, and also they can show the ideas and they say, oh, we can change that. Yeah, you are right. And so I think that will be my approach. If this doesn't change, well, if I really, really feel that this project was a great project, maybe I will come back again and do a second round and show data, show what is the reason at the beginning, what was the beginning, the objective at the beginning, what was the goal. Because sometimes when we are discussing the project, the objectives, the milestones, we forgot the reason or the root cause analysis that we have first. So that will be my approach. Thank you.
Thank you.
Okay, the next question. I know that if you are elected, you will be a member of the board, and time is always a commodity. There's never enough time to do anything. So with your organization's demand currently on time, if you miss 2 consecutive board meetings, what should you do? Let me start off with Julie this time.
Well, the first is I'm going to look at the schedule of the board meetings and accommodate my schedule. If I've made the commitment to be a more board member, then I'm going to make sure my schedule accommodates the board meetings. If I know that I'm going to miss a board meeting, I would, for a reason that, there could be a family reason or something like that, that one cannot control, I would reach out to the chapter president and speak with them to say, I'm going to miss the board meeting. Meanwhile, if this is allowed, and this is something that I don't understand the rules at the moment, but if I could have another board member cover my role for me, I would speak to them in advance. So when I reached out to the chapter president, I could say, I'm not able to meet this evening. However, this person will cover my role and responsibility for me while I'm out, and I'll touch base with them. Regarding 2 meetings, I hope it would not be 2 meetings, but I would follow that same process in the event that it occurred. But I'd want to make sure I had coverage if I was allowed to do that before I communicated to the president my inability to attend.
Thank you, Julie. Sylvia, same question. You missed 2 consecutive board meetings. What are you going to do?
Well, the first thing I will inform the board what the reason why I couldn't attend, and I will ask the person who took the minutes, so they have a video. Like now we have Zoom. I will go and review that and see what are the activities that I have to do, what is in the minutes, that the action plan that I have to move forward with that. And secondly, I will be sure next time that maybe if like you say, it's 2 times I am ready to then attend, I will, if it is super important that I have to be absent again, I will talk with the board, because there are 5 people, and see if they maybe we can arrange for another time that is convenient for everybody, but also for me too. So that will be my first idea that I could have if I'm really missing the meetings, and I want to, to have the collaboration too. So that will be one thing. But when I knew that I was going to run for the secretary, the first thing was I went to see what time are the meetings. They are by Zoom. They are during the night. So that was okay. We can do that.
Thank you, Sylvia. Neil, same question. What would you do if you missed 2 consecutive board meetings?
Well, having a role like this, I think, is a great responsibility, and with that comes a certain level of professionalism as well. Similar to what we portray in our daily jobs now, I think it's important that communication is always at the top of our priority. As the last 2 candidates had mentioned, communication is big. You can't stress that enough. When it comes to not being able to meet certain tasks or deadlines, it's important to communicate with the group to be able to see if there are any possibilities to be able to make up for it, or if there's anything that can be done prior to the meeting. For example, if there's just no possible way, or if the policy says that there are no coverages, are there work that can be done prior to the meeting so that it doesn't need to be rescheduled? Emergencies do happen, and having board members not being able to attend is a potential. And if one person can't attend, it shouldn't affect the others who have been able to free up their schedule or planned ahead. So I think the most important piece is that communication is always open between the board members. And if I were to unfortunately miss 2 meetings, I would look at the issues at what happened and discuss with the board members to see how it could have potentially been avoided, and also look from a personal standpoint to see if there was anything I could have done better to prevent that. Thanks.
Thank you so much. Tom, back to you.
I apologize. Now I was on mute. Has to happen once a day. So another question about board service. So let's say you're on the board and you become aware of a situation, a serious situation that may even cause a fellow board member to lose their seat on the board. What do you do and why? How do you handle this? We'll start with Sylvia.
Can you please repeat the question?
Sure. The gist is that you become aware of a situation involving another board member that might require them to resign from the board. How do you handle that?
Well, if the person is going to resign from the board, looks like the person already acknowledged that whatever happens is it demands that the person will be removed from the board. And I will communicate with the rest of the board what happened, what is the reason the person has to leave, and I would like to announce or call for the election, or to have a new member to replace this member, and try to analyze what happened with this member. What was the reason? It was the thing that happened that was so bad, that was bad actually, and has to go. So, and try to place policies and policies and that in the board that the next time are going to help for the members to avoid this kind of situation, because sometimes maybe because the person was not sure about what is the scope or the limit that the things that the person can do, just did it, and that will be my approach.
Thank you. Neil, same idea. You become aware of an issue.
Yeah, these types of questions are always difficult to answer. But there is that ethical line that you really have to toe. And I think at the end of the day, personal emotions and personal experience really shouldn't trump what is correct and appropriate in this situation. And in a scenario like that, personally, I would have to bring it up in a professional manner to the group, not because of wanting to oust a member, but because of the consequences that happen for it. We represent many committees, and many of the members are our state chapter. And really, at the end of the day, our responsibility is to do our best with integrity and accountability. And if we can't solidify that, then who's to say many of the other members and many of the committees would even trust us to represent them? So if I had to decide on the issue, it would be something that I would bring up to the group, so that we can address it as a group to see if anything could be done to prevent it or to address it in a better manner.
Thank you, Neil. Julie, same situation.
So if I'm aware, that means I've witnessed it or I have factual knowledge versus hearsay. I would follow the bylaws of the board, and that would mean reporting appropriately the information that I have. However, I do believe that, unless you have facts around a support, I'm assuming there's facts in this situation, provide that as well. But I do believe that everyone should be given the benefit of the doubt. And then that would be the whole board looking into the situation, verifying the information communicated, and taking next steps based on our bylaws.
Thank you. Thank you all. Tony.
Okay, I get the next question, and this only requires a yes or a no answer. So this will be real easy for everybody to kind of get there. Have you observed prejudice, bias, and any or non-compliance within a board? Why don't we start with you, Neil?
No.
Julie?
Yes.
Sylvia?
Yes.
Thank you. Yasmin, it's your turn.
Yes, and this panelist will be your final question for the night, I believe. So what has been your best contribution in your career, and how can that help you in this current position that you are running for? And I'll start with Sylvia.
Thank you, Jasmine. I will say my best contribution will be part of a quality improvement project that help underserved people and people with a substance use disorder and mothers to get linkage to care. And when I knew that some of these patients their life was safe and they were free of this infection, I think that was my most satisfaction. Even one person, two people, I knew, oh, they are safe now. They have hope to continue in this infection. Was clear. I think was the most satisfying for me, the most important. Even was only one person and two, and was very only. It was for me was incredible that to save the life of one person, and that will be the part that I would like to share.
Thank you, Sylvia.
You.
Neil, over to you. Your best contribution in your career, and how would that help you in this position?
Yeah, great question. I think the greatest contribution that I've had in my career is actually having seen a lot of the influence that I have on many younger students or those in the nursing field that have just started their career and even in the IT field. Um, what I mean by that is not many folks are aware of what healthcare IT is. Some ask many questions about it, what I actually do, and being able to advocate for healthcare IT and knowing the importance of it going into the next few decades with advancements in technology trying to keep up with the complexity of patients. I think that the way that I've been able to open up healthcare IT to a lot of my colleagues and to a lot of friends and family, and even those who are willing to listen outside in the neighborhood. I think that's the greatest piece that I've been able to accomplish in my career so far, only because I do feel strongly about being able to optimize and enhance the way that healthcare IT is going in the 21st century. And I think that that's still the main direction that I'm going to be going forward in the next few decades.
Thank you. Thank you. Julia, last but certainly not the least.
So my greatest contribution is mentoring and growing the next group of leaders for informatics and for healthcare. And as it's important that we bring up the next group because we are moving on and upward as we get, further along in our career, and making sure that there's always someone who can step in your shoes in the event for any reason that you need to leave your role. And I think that's important. In addition, from the work with professional associations, giving back and helping to share knowledge helps the greater community. And I think that's the biggest contribution I've made and my role as a nurse informaticist and with my professional career as a nurse informaticist.
Thank you so much.
Well, thank you all, candidates, and thank you to our election committee members. This concludes our debate for the secretarial position for the board. We want to thank the candidates and we wish them the best during the election session. As a reminder, the election will begin on Monday the 12th and it'll end on Monday the 26th at the end of the evening. We will tally up the votes. The winner will be notified via email. And if they don't accept, then we go to number 2. So just want to give you some heads up on that. And I would like to say, be well, be safe, and thank you all. Great job tonight. This session will be recorded and it'll be placed up on our YouTube page on Friday. So this way, all the members who are going to be voting will be able to view what they've seen here. And I want to thank both Tom and Yasmin. Great job tonight. Thank you. And everybody have a safe evening. I'm going to turn the recording off. Folks, thank you very much. If there's any other questions.
No, just
Thank
want to
you.
say thanks. Enjoyed.
Thank you.
Enjoyed
Thanks,
meeting you.
everybody.
Thank you. Thank you, candidates.
Now, if
Good luck.
if anybody is interested between now and the end of the elections and is interested in getting onto a committee, you can reach out to me or to anybody else on the board currently right now. We'd be more than happy to talk to you about opportunities and possibilities of serving the board here. Again, thanks for your time. I know it's late at night. It's after work hours, and we appreciate it. And I love Jasmine's smile. She's smiling the whole time through everything. So that means it must have gone very well. So thank you.
Yep.
Thank
Thank
you
you all.
all.
Thank you. Good night.
Have a
Thank you for
pleasant
your
evening.
time.
Have a
Thanks.
good one. Thank you all.